Dr. John McDougall. And what could be more simple to do and seem to be so unharmful as checking your breasts to see if you have a lump, to see whether or not you have breast cancer? Well, if it was so simple and so risk-free and so beneficial, then you'd find organizations recommending that you do that. But the major organizations don't. For example, the Canadian Preventative Services Task Force, they've said since 2001 for doctors to not teach breast self-examination to women. And the United States Preventative Services Task Force came out in 2010, and they told women to not do breast self-examination. More specifically, they told their doctors to not teach women to do breast self-examination. So what could be harmful about checking your own breasts? Well, first of all, you worry about it before you check them, and even after you check them, you worry you might have missed something. And then if something is found and you missed it, you feel guilty, and that's not so good at all. And what happens when you check your breasts frequently is you find things. And most of those things that you find are of no consequence at all, but because you find them, you worry about them, you have to see the doctor about it, then you have to get mammograms and other kinds of tests, and then it leads to a biopsy, and that could mean a scar, and then it could also lead to diagnosis of breast cancer, and maybe rarely that diagnosis will save a life, but every time you're diagnosed with breast cancer, you have to go on to extensive treatments, such as more surgery, radiation, possibly chemotherapy, and anti-estrogen drugs. I mean, your whole life is changed by checking your breasts. Well, these major organizations have told doctors not to teach you breast self-examination for a reason. So what do? I mean, how do you find breast cancer? Well, you know what? If you have a tumor that's important, it'll show up. You'll find it casually, say when you're washing yourself in the shower, and that's the time to bring it to a doctor's attention. Otherwise, you do far more harm than good to focus women's attention on checking their breasts all the time. I recommend strongly against breast self-examination. I'm Dr. John McDougall.